Welcome ladies and gentlemen. This tutorial is on how to unbox an Adin implant. In this tutorial, you would be enlightened on the clinical tips on how to handle Adin implant, things that can go wrong while handling implants, worst come worst scenarios and how to manage it. So watch this video till the very end for the complete information. An Adin implant comes in a box like this. It has an outer vial, which is plastic, and then you have an inner vial. In the outer vial, you will have a label which has all the details that you require for your implant. It says the name of the implant, that's Adin. It says of where you're supposed to use it. Over here it says not for human use. That is because it is a dummy implant that I'm using for a demo purpose. You would have a lot number that is here, that is your referral number. You will come to know the type of the implant, whether it is a Torag S, a Swell or any type of implants. The implant's detail will be here. It's mentioned of what type of implant it is, whether it's a dental implant or any other surgical based implants. And then you have the size of the implant that is mentioned here. The size of the implant will be mentioned in more than one places. So over here you have, it's mentioned like 5D, 11.5 L. 5D means that is the diameter of the implant. 11.5 L, that is the length of the implant. You would also see that the size of the implant is mentioned on top of the cap. Again it says 5.0D and 11.5 L. So this is how the outer vial of your Adin implant will look like. Before opening the implant, the main important thing that you have to keep in mind is whether the seal is intact. You can see there is a small extension over here which ensures that the implant has never been opened before. This surface which you are holding in your hand is an unsterile surface. So if you are a doctor who is performing the procedure, you are not allowed to touch the outer vial of the implant. This surface would be handled by your assistant. So now what the assistant would do is, they would take the vial, they will twist the cap. Now you can see that the seal is broken. You can open it and your assistant would drop this inner vial into a sterile zone, because the inner vial, what you're seeing on the inside, is completely sterile. This should not come in contact with an unsterile zone. Your assistant would drop this particular vial into a sterile bin or a surgical sterile zone. From here onwards, your assistant has no role to play with the inner vial. The inner vial is sterile and it has to be touched only by the surgeon who is performing the procedure. In the inner vial, you will have two components. You will see there's a plastic component here and a glass component which contains the implant. In the plastic component, you would have a small metal piece that will represent a screw, then that is known as your cover screw. The surface or the connection on your cover screw is a hexagonal connection. So to unwind or place this cover screw onto an implant, you would require a hexagonal implant screwdriver. Now let's keep this aside. Let's take a look at how to unbox the implant itself. Now you can see that this glass vial contains the implant inside and it is attached to a metal mount. This metal mount has a hexagonal connection on top. This hexagonal connection can be handled with your hand as well as your driver. So, initial stages, if for you to remove this implant, all you have to do is twist the hex and pull the mount outside, so you would get the implant out. You should never touch the implant surface, or the implant surface should never come in contact with any unsterile zone or even a sterile metal part. If you are in a position where you are not able to place the implant into the bone in the first go, you will have to bring back the implant and place it back into the vial and place it in a sterile zone. Make sure that you do not touch the implant, or you do not bring the implant into contact with any of the other surfaces other than it's been suspended in a vial. So now, even you are going to remove the implant and you're going to place it into your patient's mouth, you have to make sure that the implant comes in contact with the bone directly, and you can use this mount to hand tighten the implant. The advantage of the mount is it gives you an initial stability so that the first two threads can engage into your osteotomy. Once your implant is got its primary stability by hand tightening the implant into the bone, you can use an implant wrench, or what we call it as a torque wrench or a surgical wrench, to further tighten this implant into the bone. Now you can see that the mount fits perfectly into your wrench, providing you to further tighten the implant into the bone. Care should be taken that the torque should not exceed 30 Newton centimeter. If your torque exceeds 30 Newton centimeter, it would be very difficult for you to remove this mount from the implant, because there will be a process known as cold welding that takes place between the surface of the mount and the implant. So make sure that when you are torquing the implant into the bone using the mount that is provided by the company, you always make sure that you do not cross 30 newtons torque. The connection between the metal mount and the implant is a snug fit connection. So there is no screw that is connecting the implant and the mount. So if you have tightened about 2 to 3 threads into the bone, all you have to do is pull up the mount and the mount would dislodge. Once the mount is dislodged, for further placement or further tightening of the implant into the bone, you would be using something known as your implant driver. So the implant driver would have a hexagonal connection on the tip, which would completely correspond with the hexagonal connection in your implant. Select that. Okay. So once this is in connection with your implant, you can use a torque wrench or a surgical wrench to further tighten the implant into the bone. The procedure of how to place an implant into the bone would be dealt in detail on the drilling sequence and placement of implant tutorial. Now, once the implant is placed into the bone, the role of the implant driver is also over. Next, you will have to remove the cover screw from this plastic mount and place it on top of your implant to create a proper seal. Now, to remove the cover screw from the mount, you would require something known as your implant prosthetic screwdriver, which has got an hexagonal connection in the tip. Now, you place that like that, and then you counterclockwise movement, you would be able to remove the cover screw from the mount. The connection between the cover screw and the mount is a screwable type. Once the cover screw has been held on to your hex driver, now the cover screw can be placed onto your implant. You would use a clockwise direction movement to tighten the cover screw onto your implant. Once the cover screw has tightened onto your implant, the soft tissue can be closed and your implant is completely protected by the bone. This procedure will be dealt in detail during your drilling protocol tutorial. Now, in this implant unboxing tutorial, you have learned few things. That is, how to understand if your implant is sterile or if the seal is intact. Who can touch which part of your implant? Like the outer vial can be touched only by your assistant, the inner vial can be touched only by the performing doctor and not by your assistant. The third is how to carry your implant from the inner vial to the patient's mouth. So in this process, what can go wrong? And if it goes wrong, how do you go ahead and manage it? Then we have seen what all instruments are used when you are going ahead and placing the implant in the bone. You would require an implant driver. You had required to have a hex driver or an prosthetic implant hex driver for you to complete the procedure of implant placement. Thanks a lot for watching this video, and we would meet again in the next tutorial. Till then, goodbye.